Hi, everybody. It's Angela Lovezarenka from Lactation Education Resources. Thank you all very much for joining us today. We are honored and privileged to have Nikisha Killings and Nikki Hunter Greenaway joining us today to talk about how to identify fake news. So, Nikki and Nikki, take it away.
Hi, everyone.
Woo! Hey,
Yeah,
everybody.
we made it to July. Listen,
It's July.
it's been a rough
Half
ride.
the year is gone. Half the year is gone.
It is. But we're going to look at it, glass half full. The best is yet to come this year. I'm telling you, we're going upward from here.
Yes,
I am
yes.
Nikisha Killing, private practice lactation consultant, and I am community advocate and equity strategist at LER. I am director of equity and inclusion. I'm here with my partner in Nikki and Nikki Lactation Career Consultants, Ms. Nikki Hunter Greenway.
Hello, everyone. I'm Nikki, the other Nikki, Nikki G. I am a family nurse practitioner and an IBCLC in private practice here in New Orleans, Louisiana. I provide prenatal and postpartum education, and I also do all kinds of stuff in the community with a mobile clinic and stuff like that. But today we have a pretty interesting topic. The coin phrase "fake news" keeps coming up. But first, before we dive into that, we want to do a quick check-in, as we
Yes.
do with all of our calls, to see how we doing, how we living.
You want to
Florida,
start? Oh, Florida. Listen,
Florida.
listen.
would you like to
Um,
Would you like to speak?
Hello from Florida. And if you've ever heard of Florida Man, just know I've met him and his whole family, and he is real.
Ah.
This is an interesting state. It's an interesting place, but Nikki, I think this is probably the first time in a long time that your state isn't in the top 3 or 4 places where the virus is on the rise. Yay, I guess progress. But I happen to be in a state who's taken the top 1 or 2 spot consistently in the last couple of weeks. So our numbers are really multiplying exponentially. It seems more than 10,000 new cases every single day. There's even talk that that's not the true numbers, that some of the
Mhm.
positive cases are not actually being accounted for. So it's growing. It's real here. The pandemic is real. And I think a lot of Floridians are just becoming aware that it's a real thing. And so they're kind of slow to the party, late to the party, and starting to come to the realization of how important masks are. And so it's been interesting being a provider in this new space. There's an assumption
Mhm.
that I will just go out and help a family without any hesitation because, again, the pandemic wasn't really seen as a real threat here locally. And so that's my challenge, is trying to make sure
Mhm.
that it's clear to anyone who I provide services to that I am going to take the highest level of precaution, and I want them to do the same to protect me when we're in the same space.
Right.
But otherwise, we are healthy and thankful. How are you?
We're okay here in New Orleans. I think our numbers have been fudged also a little bit, just a smidget, to get us like looking like we are clean and on the upward swing, and we are not. We're on the upward swing of more COVID cases. As we hear about just bunches and bunches of people, graduations still happening. People have on masks, but they're like sitting like right next to, each other. Funerals happening. Large gatherings are still happening, graduation parties, all those types of things. So, and folks are now saying like, oh, well, it's gone, or it's just affecting a different group of people. Whereas in the news, I've seen instances of like maybe a new strand, and I was like, God, it multiplied and became more powerful. So it's a scary thing, but we're still inside. I know schools are trying to figure out what they're going to do. Doctors' offices are unsure what to do, and hospitals are kind of in limbo as well. They let doulas back in, or support people back in, and they're like, oh, should we bring them back out? So I think we're doing like a yo-yo situation where we kind of had a clear guideline, and then we're like, oh, we're better. Now we're like, oh, I think we need to go back, so it just speaks to us maybe moving too soon,
Yeah.
back to opening outside.
Yeah, I think that's going to be the case for a while yet. I don't know, how it's possible. Uh, Coming from Los Angeles, where it was a hot spot from the beginning, and it was, top of
Mhm.
mind, and everyone was taking all the precautions. It's really strange to kind of be in a space where I'm starting to realize so many people weren't taking any of those precautions, and that kind of
Mm-mm.
opened the door for the, virus to continue to spread. And so I think that we'll continue to see that through the fall. Interestingly enough, I think the conversations right now about whether school should be in person. Excuse
Mhm.
my ring doorbell there. Whether school should be in person in the fall, I think is going to impact us as providers, because we're going into homes, or we're seeing these families where their children have been now exposed to a lot of other children and maybe passing it around. It heightens our vulnerability, just in being in the community where children are in school. Even if you don't have kids that are school age as a provider,
Right.
this impact in your work. So there is much more to come on COVID. Let me tell you.
Mm. Yes. Yes. And today we're going to help you try and navigate all the news, because I'd say this morning, because I was up with my new puppy, I watched the like news on TV for the first time in at least 2 months. And just like all the stuff just hidden, hidden. I'm like, where you get that information from? Where'd you get your information from? Like, I hadn't heard that. Like, it's the difference between the news that you get on the actual TV screen, the news that you get on Facebook, the news that you get on Twitter, and then stuff that just pops up on Apple News. I'm like, look at all these different places of information, and it's hard to kind of navigate what's true and what's not.
It really
So hopefully we
is.
can help you.
It is. We want to help you do that today. I think one of the things I've noticed, and this is, directly related to what we're talking about, is that kind of no matter where you are or what your belief system is, we tend to surround ourselves with folks who believe similarly, right? Who, and not many of us are
Hmm.
comfortable being constantly challenged. Oh my gosh, every time I open
Right.
Facebook, I'm getting posts from my cousin who upsets me. We kind of work our
Hmm.
way down to a very comfortable space where we're surrounded by folks who don't upset us and raise our blood pressures constantly.
Right.
That, though, means we kind of have sometimes an echo chamber, or only receiving news from one source or one type of sources that are all saying the same thing. So it never hurts to take a beat, pull back, look for some other sources to get your information from, so that you're sure that you're getting the full story, no matter where you sit
Correct.
on things. So
Right.
I would love to start with what who not to listen
Okay.
to.
Okay. Perfect.
Identifying fake news. Now we know that fake news is a term that was coined, I believe, by the current administration, and it was, it's been used kind of weaponized to kind of really discount anything that doesn't go with, the particular narrative that's desired.
Hmm.
That's not what we're doing. We are talking about using the term to relate to stuff, information that's just inaccurate. That is just inaccurate,
Right.
not factual, not evidence based, right?
Hmm.
So, here's what I know for sure is that if you are getting your information from certain sources, it is just you're never going to be completely in the know and current, and able to fully support your families in the way that's most appropriate, right? Um,
Right.
the main theme, and I have a lot of bullets, a lot of identifiers for places where fake news can be gathered. The main theme is always going to be: is this information that's being presented to me from evidence-based, currently available information? Full
Right.
stop. If
Foundation. That's the foundation. Build
if you don't
upon
have time to ask yourself any other questions, ask that question. Is it evidence-based?
that.
Is it
Hmm.
related to current information that's available, current studies, current data? Does it make sense relative to those, what we know for sure to be true? And
Right.
we kind of have a baseline. If you're a provider, you have a baseline, so certain things are true, right? It's best for parent and baby to be together early and often, and to nurse as much as possible in those
Hmm.
first few weeks, and just how important it is to establish supply and skin to skin, and some of these things are necessary for lactation to work. And
Mhm.
so if you're getting news that's contrary to that, it should give you a pause and say, why would
I
they
wonder where
say,
they got that.
where they
Right.
get that where they get that
Mhm.
from? So, some of the things I want you to be careful about when you're gathering your news is it anecdotal? Is it just one person who's had one experience and they're sharing with you on their blog or their website, or even being
Right.
interviewed on the news? Is it though just they may be a one-off and they're just telling you their experience and it's valid and it's their truth, but is it
Mhm.
representative of the larger population and what may be happening on a much wider scale? That
Right.
should be a point you're looking for. What do you think, Nikki?
Absolutely. Absolutely. I am weary of like reviews and opinions. And while yes, I encourage you to have your opinion, but don't push it as fact. Don't push it as evidence, as that, and don't send someone like, oh, well, I'm looking for this about breastfeeding, and then you use that as your source and you send it to them, and then they're going to take it as truth when it's just simply an opinion or a review of something. So, so please, please be cautious with that.
That's a really good point, Nikki. As a lactation supporter, you are seen as an expert in this realm. So any information that you gather and you share with the folks that listen to you, now in their mind becomes fact. So we have a responsibility to make sure that the information we're passing on is well sourced, makes sense, and is in alignment with what we know to be true based on current field. So websites, blogs, anecdotes, please be very, very careful of those. I challenge you also to be really sure that the person who is relaying this information to you is not aligned with any entities that are
Mm,
questionable or that from
right.
which they may benefit by telling you this
Mm,
information or they may gain by telling you this information, right? So are they saying to you you can dyad should only be together if this particular drug is introduced, right? I would say,
mhm.
I wonder what their
Right.
affiliation with this drug might be. Why do they feel so strongly that breastfeeding can only occur, only be safe in this particular instance with this particular product? Think about that. Question everything to make sure that you're not receiving information that's benefiting someone else and thereby harming the populations that you're serving. So,
Right. Checking out where the information, if you're getting it online, checking out who's sponsoring it. Is it sponsored by somebody? Is it sponsored by a formula company? Because as you know, during this disaster or pandemic, rather, a lot of times formula companies are coming out of the woodworks and it's like, oh, because at the beginning, remember we had a formula shortage, and in some spaces we still have a formula shortage, especially the specialty formulas that are hard to find. So they can come out and say, oh yes, we have this, and we're sponsoring this, and we're gonna do this giveaway, and you don't want to be short, you want to feed your baby, things like that. And you're like, mm, mm.
mm,
And they'll have like an expert saying, COVID during feeding your baby during COVID, and there's this expert and sponsored by, a formula company, and you have to be wary of those types of things, and making sure that we're not putting ourselves in a compromising position.
absolutely. Absolutely. So that, I think that goes for studies as well. When you read a study
Yeah.
and look for that fine print that talks about disclosures or
Mhm.
talks about affiliations, it's really
Yes.
way down the bottom. You'll find that there may be some relationships that maybe have impacted the outcome
Hmm.
or that the study was developed and performed to confirm some biases that already existed, right? So confirmation bias is a problem. So if the study was conducted in order to, bolster up an opinion that was already developed before the study happened, that's a problem, right? So you
Right.
want to make sure that you're investigating the sources of the information and where you're getting them from. Let's see what else. I think also that Oh, I here's another one, sorry. Bouncing all over. One of the places where we're getting a lot of information from, or we did at least in the beginning, was from organizations that don't necessarily do any breastfeeding work or any work related to
Mm.
breastfeeding. Organizations and or individuals uh,
Right.
you know, speaking on behalf of families and explaining to us what families should do related to COVID when they don't work directly with breastfeeding at all. Here's an example of a similar type of situation. Before I entered the field of lactation, many moons ago, if someone had said to me, when a parent drinks alcohol, they absolutely need to pump and dump because that goes through the milk, I would have said, oh, that makes perfect sense. Of course. Of course, they should a parent who has any alcohol should pump and dump, or stay away from the kid and stop nursing, introduce formula because alcohol in the milk, oh my gosh, that's got to be the worst thing ever. And that makes sense unless you are a studied professional. And when you get into the work and you start to research the impact of alcohol, how it travels through the bloodstream stream through the milk, how much gets to baby, what this really looks like in a parent who's had a drink of alcohol, you learn it's not dry. It's not that cut and dry at all. And your advice
Hmm.
maybe has changed completely now that you learned a little bit, you know a little bit more about what this looks like in real lives and real families. I think that's the same thing that happened with breastfeeding in the beginning. Lots of folks were giving advice. Oh my gosh, parent has coronavirus, COVID-19, no breastfeeding. It's going to go through the milk. It's going to, and
Right.
that sounds good if you haven't studied lactation
Hmm.
and the processes involved and how the body filters and how milk is full of antibodies and can in fact
Right.
be a protectant. Then if you haven't studied all that, then the bad advice sounds good. So we got a
Right. And I
bunch of
think
that in
that's
the
why
beginning.
all of us were kind of confused. We were all like, whoa, wait, did we
Yeah.
miss something? Are they not supposed to be breastfeeding? We need to research. We need research. We need research. And you're like, actually, COVID's new. That's why it's called novel. And so we don't actually know what happens. But if we were to use, things that have happened before, viruses that have happened before, have we ever told, when you're studying for the IBCLC exam and you have your contraindications, there's like a handful of things, and none of that came up. It's like this,
Never once was a coronavirus on the list
never once.
of
Right.
contraindicated.
There's only
Yeah.
one type of virus on there. Right. And so we have to think about, we have to go back to the way we were taught and those things. Don't forget about your foundation in breastfeeding and lactation education. And that's why it's good to go to folks that actually have worked with breastfeeding families before. Like professional organizations, there are tons of professional organizations out there giving advice about breastfeeding and how lactating parents should respond during and breastfeeding a baby. But is that their lane? Is that their lane? Is that their primary thing? So if I had a question about pregnant women during COVID, would I go to a lactation organization? No. So why are folks dealing with pregnant folks dealing with the lactation? And we should really allow the professionals to do their job and to educate as opposed to folks that are not. And then they're kind of like making stuff as they go to
Yes.
create policies and stuff that now hospitals are taking as written law because this group of providers over here who has never really been trusted with breastfeeding in the first place are making policies to tell you what to do with a breastfeeding child.
If
So
we're
so
being
we have
real,
to
right?
really, yeah, if we are being real, we're not going to call out any specialties. But I mean, when was the last time you were the credited source for breastfeeding? If we're being real.
If we're, and
So,
think about your own personal life, right? All the different types of
mhm,
physicians you might see. How many of them are knowledgeable about breastfeeding?
right, right. And that's why we
You
go to
are
lactation
probably
folks.
the
They're
expert.
like, my doctor, right,
Yes.
told me not to take this medicine. My doctor told me not to take this medicine. Hey, Nurse Nikki, what do you think? And I was like, well, we could look it up in our credible resource of Dr. Hales, who's done all this research. Let's
Yeah.
look it up here, or let's look up LacMed, things like that. And I'm like, did they look it up? No, no, they didn't. They just said no. And I was like, we have to question that. So when we question that, we also question the situation that's happening now of where did they get their news from and where did they get their evidence from.
Yeah.
So.
Yeah, I think that what you'll see by and large with individuals, organizations who don't do this work regularly, is the tendency to be ultra conservative in their approach. Well, I'm going to
Mhm.
cover my behind. I'm going to do whatever I can to make sure I don't give advice that leads to a baby contracting coronavirus from a parent. So they're going to be
Right.
really conservative always and say, just don't. You know what? Formula. you know what? Separate. You know what I mean, and give
Hmm.
advice that is going to, in the end, be detrimental to the breastfeeding relationship. And so it's our job
Right.
to be fully informed so that we can be the protector and the advocate of breastfeeding where it makes the most sense. Yep. So,
Absolutely.
Nurse Nikki, what
Mhm.
about government agencies?
So let me tell you something about government agencies. So on the federal level, we've had a lot of confusion as about where we should be and what we should be doing as far as COVID. Wear masks, don't wear masks.
True.
Um, you know, social distance. You can be around 10 people. All these things. So I think what's happening is we're then going to have to go down to the state level. Now, on the federal level, we do have the entity CDC, which has been coming out, with tons of information. And sometimes even the CDC, I think, is catching themselves and they're like, oh, wait, did we put that out prematurely? Did we say we
Yes.
should have consulted somebody? That's not our lane. Wait, I
Yeah.
totally agree. So I think they've caught themselves
Hmm.
and they put out information. They're like, oh no 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 no, and then like they pull back and they're like, we actually should have asked somebody some questions first, because I think everyone is so into wanting information. Everybody wants information. And so it's been put out so fast, even by the folks that we trust, for information about this virus. Even them, they're getting bogged, hit at all
Yeah.
angles. And like, we have to say something. So they just say it. And then it's kind of like you say it and then ask for forgiveness later and then correct yourself and then put out the right information. But what happened is that same group of people that got that original information is not the same group of people that's getting the corrected information. So then there's a gap, there's a knowledge gap. And that gap has replicated itself so many times
Yep.
that now we have this whole thing of, well, they said this, well, they said this, but they said this at this time. And check your date. Check your date for when this information was released. If
Yes.
it said something like March 21st, then we can't trust that the CDC, that's the most accurate information. If it said July 1st, hell, we're still probably not the most accurate information. So,
Yes.
so with the CDC, always check your date of the article and when it was posted. And at the bottom, it'll say updated or revised, or it'll say it at the top right above the title, updated or revised, and make sure it's the most updated revision that you're receiving.
Yeah. I
So,
would say that of the United States government agencies that have been putting out information, the CDC, again, it was a little bit wonky at first, and unfortunately a lot of hospitals took that direction and ran with it. But then they
mhm,
came back and cleaned it up quite a bit. I was just reading through their policy again today. It's not bad, right? It's
right, right.
advocating for keeping dyads together. It's saying for sure we haven't seen any evidence that it spread through breast milk, and that the benefits certainly outweigh the risks at this point. And
Hmm.
separation is not going to be necessary, baby to breast, all that with these precautions. So that's where
Right,
ideally we would have started out. um it is what it is. Information changes
right.
fast. They were, rushing to get information out, and they did, what they did at first. But I still think at the end of the day, they're probably one of the federal agencies who got it right. I certainly don't think,
Hmm.
I don't think at our administration level, I don't think there's good information coming out. I haven't seen the
Hmm.
Surgeon General be really forward in information that's going to be helpful at the level that hospitals and practitioners need it. And so I think that's probably our best bet at right now is CDC.
Right.
And
For some non-political information,
yeah,
I think the CDC is our best on the federal level. Now, I would say for everything else, that's your foundation information about COVID, things like that. But you actually, a better resource as far as government is your state and what's happening in your state. Because as you see, Florida is doing something slightly different than every other state right now. Texas is doing something different. Louisiana, we're trying to stay on it, but we realize that, we still have these little hot spots. So base it off of your state and look at what your state government is doing. And then to bring it down even further, because an example of in the state of Louisiana, the state of Louisiana actually tried to is in phase 2. New Orleans is in phase 1. You understand? So
as it could
we
be.
are we are more an extended phase 1 as opposed to the rest of the state, which is phase 2, because our mayor said we look at the data and not the date. Okay. So we have to look at the numbers first before we can determine that. And she saw that we weren't moving. So she's like, we're in a modified phase 2 maybe, but it's more like phase 1, which all this stuff gets blurry anyway. So you have to look down even further at your health department and see which guidelines that
Yes.
they're putting out, because they may have some different ones of everybody has to wear a mask. And so when you contact a client and they're like, you know, I don't want to wear a mask, and you're like, well, we're in the same county, parish, or whatever. It says we have to wear a mask. So you may get hit with that. So go down to your local level if that's what's necessary.
I think that's a great point. So that's what's happening kind of, government wise. What about on a global scale? Who's got a good voice to support us globally? What is she?
Italy, maybe.
Well, I was
I'm
thinking
gonna
more
go with the World Health Organization.
who is trying? Who is
who
trying?
who is trying? I mean, I feel bad for. I feel like I need to send them some CBD oil or something, because I
Yeah,
feel like they just,
yeah.
they really, really stress, and I think the U.S. is part of their stresses, because they like, why y'all so stubborn? Why y'all not listening?
Listen,
Why
listen.
you
Can
not
I say
listening
this?
to us?
Y'all have to forgive me because I go on tangents, but listen. The WHO had to put out a statement that coronavirus was not related to 5G. They had to put out they had a whole campaign. They had memes on social media. This is the type of thing they are bogged down with. They're busy, okay? And we are keeping
They're
them
busy.
busy as
They
well.
had to say that you can't drink Lysol. They like,
They
wait,
did. They had
what?
to say that.
Let me get the U.S. together.
So there's,
They have a special phone for us. Like, pick up the call. Y'all folks is doing the most over there. 3 million cases. What
yeah,
the hell?
yeah. So I
So,
think they're trying. I think they're
yes.
a voice. I think that they have a much more international perspective than
Mhm.
anyone that's speaking on behalf of the United States right now. And so they're
Right.
able to see the pandemic for what it is globally. How's it affecting this part of the world, this world, this part of the world, this part of the world, and make recommendations thus.
Right. That benefits
Um,
everyone. That is sound recommendations that
in
would
theory,
benefit breastfeeding families. But when you're dealing with a country that is not as breastfeeding friendly as some other countries, it kind of hits you like, why would we do that? Well, hell, that's what we're supposed to be doing in the first place, remember?
yeah,
Skin and all that kind of stuff.
yeah,
So it kind of, now we're really, really pushing it, and people's like, is that a priority right now? Well, it's always been a priority. It's always been a priority. So that's, my friend said, who I love them.
yeah. Who bless your hearts. Yeah. I'll
Yeah.
I'll pause right here before we go on. Angela, is there a question? Please don't let us
Oh,
miss any important
we
questions
were just talking amongst
from the
ourselves.
audience. Yeah.
No. So one person who is participating said that Oklahoma made it to the New York official quarantine list. Makes one
Oh,
proud. So as y'all were bragging about
welcome.
your states,
Welcome, Oklahoma.
We have a support group here.
sadly, yes. And then somebody mentioned also, or had asked a question which you may not know the answer to, which is when SARS and MERS were out there, which were also corona type viruses, when they were out there, was breastfeeding contraindicated?
I don't even think they
Um,
even acknowledged that breastfeeding would be affected. Like, I
yeah.
don't recall anything like that. Nor have I seen that in any of it, because the SARS is that. Well, no, I had never seen any information related to SARS and breastfeeding. No,
No, and I've
but
read a little bit about both of those during this current pandemic because I wanted to be able to compare. And there wasn't that I found a lot of guidance given about breastfeeding. It just wasn't on the radar back then as much. I would bet though,
mhm.
at a local level, at an individual level, practitioners were saying, it's probably best not to. Again, that really conservative, really,
Right,
CYA approach was probably
right.
being deployed a lot more than what would be ideal. Yeah.
Right. And someone else asked a question, and I didn't want to surprise y'all with this, so I went ahead and looked it up real quick.
Oh,
And
okay.
their question had to do with the RNA that's being found in breast milk
Mhm.
and what that really
Mhm.
means.
Oh, what did you find, Angela?
Okay.
What I
What did you
found
find?
was something from the World Health Organization, a scientific brief on breastfeeding and COVID from the 23rd of June. Y'all said to check your dates. So there's the
Nice.
23rd of June.
Mhm.
And it's interesting, it, supports breastfeeding. It says that concerns have been raised. And then it also says that the World Health Organization recommendations, mothers should be counseled that the benefits of breastfeeding substantially outweigh the potential risks for transmission. Would you care to comment on that? And they even go further. Parent and infant should be enabled to remain together while rooming in throughout the day and night, and to practice skin-to-skin contact, including kangaroo mother care, especially immediately after birth and during the establishment of breastfeeding, whether they or their infants have suspected or confirmed COVID-19. Care to
Yeah,
comment?
it's a little different approach than we're seeing here in the United
Right.
States. For sure. I think it's my first response was, man, that's really courageous. It's a really brave perspective, but it's not. It is
Hmm.
backed up by data. It makes sense, right? But it
Right.
feels for us here like, oh, they
Oh
really they
gosh.
really put that on paper, you know. But yeah, this is kind of one of those stark differences between the way this, the messaging is being handled at the various levels. So please don't discount
Right.
who when you're thinking through who I can trust on this, and what is a
Hmm.
valid source of information, what is fake news versus what is real, who actually is real news. CDC is real news as well, but it's certainly going to be a little bit different approach. Um,
Right.
work, yeah.
Right. They're
So
going to have
Thank you for that.
some people dictating, what gets released and what doesn't, and syntax is going to be a little different.
Yeah, and it matters that the United States is litigious, right? It matters that folks are happy to sue, when something
Hmm.
goes wrong and place blame, and physicians will lose their careers. That kind of thing impacts some of the messaging that we'll see here versus worldwide. It just is what it is.
Well, and that's what someone asked. They said, to your comment that the CDC, should be one of those places, they are asking, what about how the CDC changed their tune about mother-baby separation
Yeah,
after how they have flip-flopped and
yeah.
had three different statements, really? Any comment on that?
I think they heard our voices, like of our professional organizations, and like and they were challenged, like, where did you get your information? How did you
Yeah,
come up with that? Like, and seeing in other instances, if we could take something as simple as the flu virus, but something that kills, tons of people every year, and how we always tell moms, keep breastfeeding, it helps your baby. And I think they were challenged a lot. And those challenges were mounting more and more every day. And even some of the professional organizations that should
yes,
know better, I feel like, came out and said some different things, and people challenged them, and
true.
then which also influenced the CDC. So our voices were clear, and that, hey, we have these guidelines based on tons of research, valid research in the United States. We don't have to use global in the United States, and
Yeah.
they speak for itself. So
Yeah, absolutely. To that end, I would be remiss if I didn't mention the United States Breastfeeding Committee and the work that they do at a
yes.
national level. That Nikki talked about, really sourcing your information from folks whose lane this is.
Hmm.
That is an example of a resource whose sole focus is, in fact, on breastfeeding, and who
Right.
consistently puts out information that is well researched and makes sense for breastfeeding families. So please add them to the list of places to get solid evidence based information during this
Hmm.
coronavirus. All right, so
Right.
those are government organizations. We went from international down to state level, and even talked a little bit about your physicians that you might encounter, and your local department health
Right.
folks that you might talk to. So what about professional agencies?
I think at the top of my list, especially for folks that are trying to figure out what we can and can't do, or some people that have not, or like we've talked about this in the floor with IBLC and IBCLE, and their guidelines, and making sure, again, check your dates, of certification, recertification, all those types of things, how you can get your hours. This is time during that time of COVID, of those things have slightly changed, making sure that you're updating that. But making sure for all of your professional organizations, log on and make sure you're getting email updates. I know a lot of us get tons of emails, tons. I have 7 email addresses. Get tons of emails. But if you don't get the email, like if you don't get those updates, you may go to a source that has an old update. And that's why it's so important to check these dates. So sign up for your email updates, because when anything comes out with ACOG, A1, NPWH, all of the organizations that I'm with, I get inundated with emails and telling this is the latest, and it'll flag it and all these types of things. And look at it and glance it. And if you need to print it, go ahead and print it and put it in your resource, or just create your Google Drive or whatever, so you can have the most updated information. But please sign up for your email updates.
Yeah, for me, that would be IBLC. It would be ILCA. So for those of you who are
Mm-hmm.
new to the field, that's the International Board of Lactation Consultant Examiners. It will see ILCA, the
Mm-hmm.
International Lactation Consultants Association, and then also the USLCA, United States Lactation Consultants Association. All of those organizations, and then there's also regional and I believe even state level lactation consultant
Right.
associations and coalitions that do this
Mm-hmm.
work and put out information that is sourced from WHO and CDC and studies related to this work. So those
Right.
are all, I think,
Right.
trustworthy sources, far and above a blog, a statement from a government official who doesn't have anything, any background in breastfeeding, or any other,
Mm-hmm.
a doctor on TV, you know, versus any of the other
Right.
sources that we may run across that are not versed in this work. Yeah.
Exactly.
I Some of them, one I give a shout out to is AAFP, the Association of Family Practitioners, put out a really strong statement. So therefore family practitioners should be getting this information and should be sharing it with their families, right? Ideally.
Mm-hmm.
Um, and so it helps to know what association some of the professionals that you work with are part of and what information they're taking in. Are they getting the most current news? I had a talk with our family practitioner, like, what are you telling families now? And and she said, "Oh, I have the CDC guidance," and it was the first guidance, and I was like, "Oh, okay. How about this one? Go ahead and look at what your organization
Let me slide
AAFP
this
is
across
saying."
the
Yeah,
table.
yeah. And so we have to we have to be the advocates for this, the factual information related to breastfeeding in our communities. We can not only be on the
Right.
receiving end, we are also going to be the advocates and proponents of it. So please make sure
Right.
you get your muscle strong to be able to do this particular
Right.
side of it as well.
Right. I want to empower you during this time. We're not in limbo. Like, our voices are not in limbo. Like, they need to be heard, because our practices and our guidelines, our evidence is being challenged every day. It's being challenged, and it could truly dictate how we work and navigate and move in this space in helping breastfeeding families. Because know this, in 2019, 2020 year, our
Yes,
breastfeeding rates, woo,
yes.
baby. Okay. And we need to know these things, and we need to make sure that the evidence, we still have that groundbreaking, true, always evidence, so we can continue this struggle, because we know that our breastfeeding rates, and if they haven't, I want to hear in the chat, how have your breastfeeding rates, has anyone seen like a drastic decline? Has anyone seen increases in their breastfeeding? Do they think that their city or area is doing an amazing job in breastfeeding and keeping this all together during this time? So we want to know if maybe you've seen the opposite, but I'm guessing that our breastfeeding rates in the state of Louisiana are about to, and we were already, we're 49. Okay. So
Yeah,
us in Mississippi are kind of,
yeah.
so,
It's not looking good.
um,
I think that we're gonna have, if we were worried before about the rates being low, I think we're gonna really have a dip that we need to contend with after this, and it helps to be prepared for that. Know that your work is going to be look different and be greater when all this is said and done. I'm
oh yeah.
excited about all the things I'm seeing, helping to increase the number of lactation providers in the field, because we're going to need all of them
Hmm.
on the other
For
side of
damage control.
for damage
For damage
control.
control.
For sure. I
Yes.
would be remiss again if I didn't mention lactation education resources in their fantastic COVID-19
Woo woo.
tab. I'm pointing to Nick. Oh, wait, there you go. Well, anyway, how do I get to? Yeah,
You.
Nikki,
Yeah.
Nikki over there. Both of us um,
Uh-huh.
are on the lactationtraining.com/. COVID-19 LER
Hmm.
website, where there's tons of fact sheets that we provided that are related to lactation support during this
Hmm.
coronavirus. All of our talks are there. Will continue to be here before you for as long as it's needed. So please make sure that you count us as a valuable resource. One other thing while we're talking about organizations that focus on breastfeeding is I am super excited about Kelly Mom. Kelly Mom. Always been a fan of Kelly Mom for supporting families
Hmm.
and the information that she provides on breastfeeding. But she's put out a COVID resource list. COVID
Get out, Kelly.
for infants. Yes, yes. Breastfeeding and infant resource list. I think Angela's going to add that to the chat. She put one out in March, and it was, okay, and had some good links. But this one that she released this week, with updated additional resources, really is a fantastic source. It's got links to great articles, latest studies by Lissa Bartik and those wonderful clinicians and researchers who are doing the work to make sure that families get to
Hmm.
stay together, and they get to do so because this evidence shows that it makes sense. So
Awesome.
don't sleep on Kelly Mom. Angela will put that link in the chat for everyone to get to see her. Listeners, if you know of other resources that have been really solid and that you trust right now to guide your work, please share those with us as well.
Yes. Any other questions, Angela?
So to your comments, and please do chat in or put it in the questions box. There's not the chat box in GoToWebinar. So please put it
Oh,
in the
sorry.
question box. We are hearing that in South Carolina, the WIC rates are up, exclamation point. So someone's very happy. And
Hmm.
it seems like in North Carolina, it says we are seeing lots of inductions, quote, just in case, which leads to difficulties with breastfeeding due to interventions and early deliveries.
Yeah, thank you for
Hmm.
mentioning that. And those facilities that are doing those just in case are following some guidance, right? I don't know. I don't know what guidance. I don't know how they've interpreted some of that early CDC stuff that was truly vague was interpreted in harmful ways, and they may still be
Right.
working off of that. But we are going to see some dire consequences because of this lack of
Hmm.
solid information. So I'm excited about identifying places where good information exists, and hopefully we can pass those along to our facilities that are looking at outdated information. I hope. I hope you feel
Right.
empowered to pass along some of this to the facilities that you work with and that are in your community.
Well, and someone has asked if there are, how does someone who's working in the community actually reach out to the birthing facilities in their community? How do you reach out and give them the more accurate information? I mean, those are tough conversations to have. Do you have any ideas?
Oh, for sure. They're not easy by any means. But when I hear, I think the way that I do it, I usually hear via patient, like, oh, they told me to do this in the hospital. They said that I needed to do this, and I contact the lactation department, and I say, oh, a patient told me that they experienced this, or you told them that. I just want to get a little bit more information about your recommendation, and then if it's off, then I was like, well, I have some, updated information, or we've had this recently about tongue ties and about babies having tongue ties, and like, oh, you have to go to this provider because they're the only provider. Because I'm like, I have a whole resource page, of things, and I shared with them. I shared with Angela and Nikisha earlier this week about a provider telling babies to take Gatorade, drink Gatorade at 6 weeks and cut it in
Ooh.
half with water. And it's just like sent some through my body, and I was like, I was about to risk my whole life to go over
Yeah.
here and advocate for my patients, but I have to
Yeah.
take a step back and it's like, okay, we have to tackle this in a an interesting way. So we're
Yeah.
working on that.
Yeah, it's not easy. It's not easy at all. I would
Mm-mm.
offer that this is now more than ever an argument for why we need to have relationship with the birthing centers around us already, and why we need to be working on
Yes.
them before issues arise, so that we are a trusted ally, partner
Hmm.
for them, that they see that they can they can get good information from to share with their families. And that's not a thing that happens
Yeah.
overnight. If you're finding yourself in a position now where you don't yet have those relationships, you may have a tough hill to climb. Doesn't mean you shouldn't try. For me, it always helps to come armed with some information, cute little easy reference guides. Cute. So they're
Yeah.
not text heavy. I don't bring the whole study. I make a quick
Mhm.
little bulleted sheet that they can reference. They can share with their families if they so desire. And then at the bottom, there's some references if they really want to look into the data. But it
Yeah.
helps to, just kind of not come in a way that may, cause it to shut down
Stronghold.
completely. Yeah.
Right.
Yeah.
Like,
Um,
don't use your strong arm.
don't do that. Angela, thank you for that Hopkins link. Can you tell us about that?
Yeah, no, someone just put it in the chat. I don't want to, if the person who put it in the chat says, yes, I can share their information, I will tell you who popped it in here. I'm trying to be respectful of confidentiality. And this is someone, the same person who talked about the breastfeeding rates in their community she said I can use her name. It's Norma Escobar.
Hey,
And
Norma.
Hi,
Norma,
Norma.
Good to hear from you. We owe you an email back.
perfect. So the Hopkins Humanitarian Health is one of her favorites, and she
Yeah.
loves it. And I, went to it, and I found fantastic. It's last updated yesterday, and it
Great.
has publications for June, July, May, April, March, February. So it's really, and they have a specific repository only on COVID-19 breastfeeding, infant feeding, and breast milk with regular updates. So
Thank you, Norma. That's
Oh,
fantastic.
beautiful. Thank you.
I didn't even
absolutely,
know about that. Yeah, Johns Hopkins has been really at the forefront of collecting data around coronavirus in general. So I'm really excited to hear
they're really
Yeah.
on the cutting edge here. It's really
specific work.
fantastic.
Yeah.
And especially on infant feeding and
Mhm.
breastfeeding and breast milk
Hmm.
feeding. That's fantastic. And it was updated as of June 29th.
Great.
Yeah.
Great. That's good
Great.
stuff.
I think a creative way to disseminate information in a nice and, neighborly community way is maybe create a newsletter, like a MailChimp or something that has like some COVID updates if you do a COVID update every month with some links and stuff. Because I will say this, coming from the hospital, they may be inundated with stuff and they may not have access or have the capacity, the time, because of all the stuff that's coming through. They're running people out, super fast to do their own research.
Yeah.
So, in defense of them, the hospital lactation departments or providers, they may not, they only get what's given to them, from a higher up or something like that. And they may not have the time to fact check it and is like, is that real or is that, okay, I'm just going to roll with it.
Yeah.
So you can be that resource for them and have like a MailChimp or whatever, send them out an email blast once a month, say COVID updates, lactation COVID updates, and have some links to some 3 articles or something like that to keep them fresh and compliant and real.
I would agree. I would agree. I think that's all I have. The only other organization that I don't think that we mentioned that physicians seem to really listen to is the Academy of Breastfeeding Medicine. And
Yeah.
so that's another resource that you can direct your doctors to who are doing this work. If they don't want to hear from you or believe you, you can certainly point them towards the professional organizations whose voices that they trust. And that seems
Hmm.
to sometimes be a way to get your foot in the door in terms of getting information out there and received.
Yeah.
Any other thoughts, Nikki? We covered all we
Um,
talked. Oh, we thought wanted to
I think
cover.
we've covered everything, and I would say like the lactation professional organizations, that should be, just as a side outside of COVID, that should be your space to getting your information in general, from about lactation education. And one of the things, just to cover myself as far as liability, anytime a patient asks me about information, I always send them the resource as opposed to verbally telling them, so
Mm,
they can see for themselves exactly where I got the information, so it doesn't sound like I'm just rattling off something. For example, hey, Nurse Nikki, is Zyrtec safe while I breastfeed? Let me pull it up on my phone, screenshot, and send it to you. And so they can see, oh, well, that's where she got it from. And they have no doubt in their mind of saying, is it safe or did she make it up or is she sure? that's where I got it from, and that's the information that I give you. So you can do the same with your COVID updates. It's just pop in the link, send them the graphic or whatever it may be, just to kind of make them feel like you're not making it up and they have a source for further reference for themselves.
Yeah, I think that's a great idea. And if you do that ongoing, then you're there as a trusted resource when they need you, right? They say, "Oh,
Hmm.
wonder if Nurse Nikki said anything about this." They can quickly reference the newsletter or the last thing they saw from you that's in their inbox.
Right.
And that's a great way to just stay before them, and remind them that you're there for them. That's what we have today. I hope it's been helpful and
Hmm.
useful. Hope you were taking copious notes and you got all those acronyms and all those organizations, and you also took note of who not to listen to. Right? It was not
Right.
such good resources, but I have a feeling some of those you knew, and some of those you probably could tell us stories about as well.
Hmm.
We'd love to tell you about our next time. We will see you here, same place, same time. Would be on the 22nd of July. That week, we'll be talking about understanding the WHO code and how it's impacting families during dual pandemics. And that would be the coronavirus pandemic and what's going on globally, racially, the uprising that's occurring all over the world as well. So, where does WHO code exist in this? What does it even mean anymore? Is it relevant? Does it make sense? And how could it be possibly impacting families right now, with all that we have going on? You don't want to miss that one. We will be ready to share lots of great information with you. Again, it's in 2 weeks on the 22nd of July. We'll be here talking about WHO code. Then 2 weeks after that, we'll be seeing you during World Breastfeeding Week, and we'll have a celebration here for WBW, and we'll talk about what that looks like again all over the world in the midst of a coronavirus, in the midst of pandemics that are happening, what it looks like to celebrate World Breastfeeding Week. And we'll follow that up 2 weeks after that with celebrating a Black Breastfeeding Week as well, and what that looks like this
Hmm.
year. And boy, oh boy, we got lots to talk about. You don't want to miss our next few talks we've got lined up for you. I think that's it. Angela, is there anything else? Have we missed anything? Oh, and
Just
links
lots.
to register for those are up on the site. Sorry, go ahead.
Yeah,
Yeah.
no, there's just lots of gratitude in the chat. So thank you both very much, and comments for
Thank
you both
you.
to stay safe.
Oh, thank you. Same to all of you.
Thank you. Stay safe, be well, and we'll see you next time. Let us know if there's anything you want to talk about or anything that we didn't cover. We'd love to hear feedback from you. Till then, take care.